topic today is hypergranulation tissue resection done as part of ingrowing toenail surgery. Here's a post from Facebook. This was shared with the permission of the original poster, who'd shared a case of a 15-year-old boy, no medications, fit and healthy, and had had a bilateral partial nail avulsion with finalisation in the July of 2020. The medial side had healed all fine, but the lateral side never really healed and has now developed a granuloma, or hypergranulation tissue we might call that. The podiatrist had applied silver nitrate, which was the black yicky stuff you can see on the nail, to try and shrink the sulcus back. Never works unless you catch a really small one. It's very vascular. And the original poster was asked what she could do. So I see posts like this on Facebook probably every week. I responded with the original poster and said, really, this needs sharp resection. And I really strongly recommend sharp resection at the time of the original ingrown toenail surgery. And I've advocated this for many years. In fact, just had an article published earlier this month on it with my colleague Nicola Burt. So this is an article that was titled Peri-ungual Soft Tissue Resection, and it's in the March-April edition of our UK rag, the Podiatrist. And we had a look at the evidence base to look at sharp resection of hypergranulation tissue with ingrown toenails, and interestingly found very little. Quite a few authors say you can do it, but there's not a lot of high quality research, so that's something to consider for the future. We've put the article on ResearchGate, so you can find it there and have a look, and by all means let me know what you think. And we've kind of read around the subject a little bit. So here's a case. This is kind of a 22-year-old that came in a few years ago now, actually. This is 2018. There's the top-down views, and here's the end view. And you can see both first bilateral stage 3 hypergran. You could do something like a Noel procedure for it, 2007. There are various soft tissue techniques. What I'm going to show is two vids of how we just resected this. Basically, it's a less aggressive Noel. So you can see the nail spicules top left, out of both first bilateral PNA, and this is my colleague sharply resecting the hypergranulation tissue out, and we do this routinely with all our stage 3 ingrown toenails. Slightly longer video on the right side, so it's basically a kind of a top-down ellipse getting back to quasi-normal tissue, and it's our strong contention and experience that these will heal a lot quicker if you do this as part of the ingrown toenail and you don't end up with those chronic hypergranulomas.
On the laterals.
And they bleed a little bit sometimes, but they generally do quite well. I say generally do quite well. They heal much quicker. Yes, you'll get some bleeding, some claret, but overall it's an advancement of the technique I would strongly suggest. Different case, but this was about 2 weeks after nail surgery with hypergran, and just look how quickly that settles down. So, thanks for watching. Have a little look at my article, and feedback always appreciated.